Sudden death during sleep causes, warning signs, and prevention. Tong Xiaoyu, founder of the Chinese AI company SenseTime, which was once sanctioned by the United States, passed away suddenly in his sleep on December 15 last year. He was 55 years old. There are many reasons for sudden death during sleep. In this article, we will explore the possible causes of death during sleep, the population most at risk, and prevention methods. Causes of sudden death during sleep. Sudden cardiac death is a common occurrence, accounting for around 15 to 20% of all deaths worldwide. Studies have found that approximately 22% of cases of sudden cardiac death occur during the night. The elderly population is more susceptible to diseases such as hyperlipidemia, hyperglycemia, hypertension, and atherosclerosis, which increase the risk of cardiovascular diseases. A significant myocardial infarction can result in sudden cardiac death. Similarly, patients with sudden arrhythmic death syndrome may experience severe arrhythmias, increasing the risk of sudden cardiac death. This syndrome can occur in children, adolescents, and middle-aged individuals. In addition to heart disease, sudden death at night may result from sleep apnea syndrome. Breathing pauses during sleep can cause oxygen deprivation, increasing the risk of arrhythmias. Prolonged oxygen deprivation can also lead to heart failure and increase the likelihood of stroke. If you experience heavy snoring, frequent nocturnal awakenings due to airway obstruction, and excessive daytime fatigue, you might consider the possibility of sleep apnea syndrome and seek prompt medical evaluation and treatment. Carbon monoxide poisoning is another potential cause of SADS and can happen when using heaters or gas-burning appliances in winter, or when idling in a car with incomplete fuel combustion. If a person experiences dizziness, weakness, nausea, or vomiting while awake, it could indicate carbon monoxide poisoning. Drug overdose is another factor that can lead to sudden death during sleep. Some medications used to treat arrhythmias, high blood pressure, and depression can potentially induce arrhythmias. The risk is even greater when these medications are combined with alcohol. Individuals who drink excessive alcohol at night are also at risk of sudden death during sleep, particularly if they vomit while asleep. This can lead to aspiration pneumonia or airway obstruction, further increasing the risk of sudden death during sleep. Some babies may experience sudden death during sleep for no apparent reason. Babies who sleep on their backs have a lower risk of sudden death compared to those who sleep on their stomachs or sides. Symptoms and first aid. Rescue efforts can be challenging if someone experiences a sudden heart problem during sleep, unless there are obvious symptoms and someone nearby is able to provide timely first aid. Therefore, it is important for everyone to learn artificial respiration techniques. While artificial respiration may not always restore a normal heart rate, it can at least reduce the brain damage caused by oxygen deprivation. Timely use of a defibrillator is crucial for saving lives. If treatment is initiated within the first few minutes after a sudden cardiac arrest, the survival rate can be as high as 90%. For every minute of delay in treatment, the survival rate decreases by about 10%. If cardiopulmonary resuscitation is not performed, a sudden cardiac arrest lasting more than 8 minutes can be fatal. Recognizing signs of sudden death syndrome. To guard against sudden cardiac death, pay close attention to the following 3 signals. 1. Consider genetic factors. Many heart diseases can be inherited. If someone in your family has died suddenly from heart disease or for unknown reasons, you may have a family history of heart disease. 2. Monitor for symptoms of palpitations or fluttering sensation, as these may indicate arrhythmia. These symptoms tend to worsen during or after exercise. 2. Dizziness or fainting during exercise. While most exercise-related fainting episodes are not severe, in some cases, they may indicate an undetected heart condition, such as aortic stenosis or arrhythmia. If you frequently faint during or after exercise, it is advisable to consult a doctor. Prevention methods. There are several key preventative factors to consider for sudden death during sleep. Manage stress. Stress management is essential. Before Mr. Tong passed away, his company was constantly embroiled in operational crises, and reports indicated he was under significant political pressure. Stress can increase inflammation in the body and is linked to factors that can damage the heart, such as high blood pressure. Chronic stress can also affect the heart indirectly by disrupting sleep and leading to neglect of exercise and diet. These negative lifestyle changes can put your heart health at risk. Diet and exercise. A balanced diet is crucial for ensuring an adequate intake of nutrients and electrolytes. Additionally, regular exercise can help lower blood pressure, reduce the risk of diabetes, and decrease inflammation throughout the body, thereby managing the risk factors associated with heart disease. Be proactive. Many young people may have already been affected by cardiovascular diseases. However, they may not exhibit symptoms due to their heart's strong compensatory capacity, which masks the underlying heart damage. Therefore, it is crucial for people of all age groups to proactively adopt preventive measures to safeguard their hearts.